Okay, so this is the presentation for the best practice workshops for assisted homeless veterans in Canada. So a series of workshops were conducted across the nation. This is following a study, an evaluation study that was conducted in 4 cities across Canada: Toronto, London, Montreal, and Victoria. And this study looked at using a housing first approach to solving the issue, or at least helping the issue, of veteran homelessness in Canada. So the workshops were conducted across 10 cities across Canada. They were hosted by the Royal Canadian Legion. These areas were selected based on the significant numbers of veterans experiencing homelessness in these cities. So the workshops themselves included many different approaches and exercises. Most notably was the group exercises. So creating teams, collaborating on a problem, or coming up with new ideas for solutions, achieving a successful outreach, developing ideas for a housing assessment tool, and in-home harm reduction, peer support programs, and developing collaborative partnerships. So some of the attendees to these workshops included local municipal governments, so local councillors, for example, Veterans Affairs Canada, so representatives of the VAC, homeless serving agencies, mental health and addiction agencies, local homeless partner and strategy designated communities, and Indigenous communities. So representatives from these communities also attended. We also had a good number of veterans themselves attend these workshops. So we had quite a blend of different people from different backgrounds, all coming together to collaborate on these exercises and to learn from the findings of the Housing First study across the 4 cities. So this was based on a Housing First evaluation study that had previously been conducted in 4 cities: Victoria, Calgary, London, and Toronto. And in these 4 cities, a Housing First approach was used to try and better help homeless veterans across the country. So what were some of the findings from these workshops? Well, key to these workshops was collaborating. From our scale of 1 to 5 on a feedback form that was handed out to all the attendees, the workshops averaged a rating of 3.91 out of 5. So effectively 4 out of 5 in terms of generating opportunities for collaboration. As well, the workshops encouraged and facilitated coordination between services. Some of these services were not aware of each other and had not previously collaborated. So this was very useful in finding new solutions. New partnerships were also developed to create a more effective approach, or hopefully to create a more effective approach. It also highlights the unique needs and approaches required. Homeless veterans have different needs and require different help compared to the general homeless population. So bringing these groups of people together, these attendees for these workshops, allowed us to find the unique approaches required for assisting veterans. As well, the workshops provided greater awareness for service providers and stakeholders. So this is very important in helping people to know what's available, what resources are out there. So some of the recommendations from these workshops. So the key recommendation, key partners need to be involved in housing initiatives. So not just the homeless serving services, but also the VAC, local branches of the Royal Canadian Legion, emergency shelters, and local police services. As well, a recommendation was to establish a community of practice. Having collaboration in place, having these services all in contact with each other to establish a good routine and good practice in terms of helping those in need. Again, the complex needs of veterans need to be considered during planning. Veterans have different needs, different requirements, so it's important that these are taken into consideration as opposed to a blanket approach covering all homeless individuals. The veteran population is unique and have different life experiences compared to the general homeless population. To conclude this presentation, all workshop sites, group activities allowed attendees to network and collaborate on strategies. Again, this is very important in identifying the unique needs and how to approach them. Future endeavours should continue and maintain the collaborative efforts initiated at these workshops. As well, federal policies need to be better implemented at the community level. It was noted by a number of the attendees at the workshops that federal policies were not well implemented and did not have a significant impact at the local community level. This is something that needs to be addressed, and so that we can see these changes to be more significant in the community at the individual level. Thank you, and I hope this was informative, and I hope you enjoyed listening to this presentation.